Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Ever faced a health issue, maybe like high blood pressure, that just sticks around no matter what you try? You take the meds, but it doesn't budge.
Yeah, that's a reality for a lot of people. It's called resistant hypertension.
Exactly. And it's incredibly frustrating. Now, what if there was another option? Especially if, the usual medication has side effects you really don't want.
Well, there's some interesting new research on that, actually.
That's what we're diving into today. A study comparing two specific medications for this resistant hypertension. Spironolactone and Amiloride.
Right.
We'll break down what they tried to find out, how they did the study, and crucially, what the results were. We've got info from a health news summary and the original scientific paper itself.
Our mission, really, is to see if amiloride stacks up as a viable alternative to spironolactone, particularly for people struggling with those side effects.
Okay, so before we get into the study itself,
hmm
maybe quickly define resistant hypertension.
Sure. So resistant hypertension is basically high blood pressure that stays high, even when someone's already taking 3 different kinds of blood pressure drugs.
3.
Yeah, typically including a renin-angiotensin system inhibitor, a calcium channel blocker, and a thiazide diuretic. These are the usual first steps.
And it's quite common.
It affects maybe 10% of people with hypertension, and unfortunately, it often leads to worse outcomes than, regular high blood pressure that's easier to control.
So where does spironolactone fit in?
Spironolactone is often the next step, the 4th drug added on, but it does have drawbacks.
Like what?
Mainly, it can cause high potassium levels, which can be risky, and it can also cause hormonal issues like gynecomastia, breast enlargement in men.
Not ideal.
Definitely not, and that's where amiloride comes in. It's also a diuretic, but it works a bit differently. It helps hold on to potassium, so it's potassium-sparing, and crucially, it doesn't usually cause those hormonal side effects.
Okay, so it looks like a potential alternative on paper.
Exactly. Which brings us to the study's main question.
Right. What were they specifically trying to answer?
The core question was this. In patients who already have resistant hypertension, despite being on those 3 standard drugs, is amiloride basically as good as spironolactone at lowering their systolic blood pressure when they measure it at home?
Systolic, that's the top number.
That's the one. The study title is pretty direct. Spironolactone versus amiloride for resistant hypertension, a randomized clinical trial.
Makes sense. So how did they set it up? What was the methodology?
Okay, so it was what's called a prospective, open-label, blinded endpoint randomized clinical trial. Quite a mouthful, I know.
Yeah, let's break that down a bit.
Right. Prospective just means they followed people forward in time. Randomized means people were randomly assigned, like flipping a coin, to get either spironolactone or amiloride.
Okay, what about open label and blinded endpoint? That sounds contradictory.
It does a bit, but it makes sense here. Open label means the doctors and the patients knew which drug they were taking. Spironolactone and amiloride look different, so blinding that wasn't really feasible.
Okay.
But, and this is the key part, the main measurement, the endpoint, which was the change in home blood pressure was assessed in a blinded way. The people analyzing the blood pressure readings didn't know who took which drug.
Got it. That helps reduce bias in judging the results. Where did they do this?
It was done across 14 hospitals in South Korea. They enrolled 118 adults aged 19 to 75.
And these were all people whose blood pressure was still high despite treatment.
Yes. Specifically, their home systolic blood pressure was 130 or higher, even after they'd been on stable doses of those 3 initial drugs for at least 4 weeks.
And the 2 groups?
Pretty straightforward. They were randomly split, 1-to-1, so 60 people got spironolactone, starting at 12.5 milligrams a day, and 58 got amiloride, starting at 5 milligrams a day.
Were those doses fixed?
No, there was room for adjustment. After 4 weeks, if someone's home systolic blood pressure was still 130 or more, they could double the dose up to 25 milligrams for spironolactone or 10 milligrams for amiloride.
And how did they track the blood pressure?
People measured it themselves at home twice a day. The researchers also checked adherence by, counting the pills left over.
Smart. And the main outcome they were watching?
The primary outcome was the change in that home systolic blood pressure reading after 12 weeks of treatment.
And you mentioned something about non-inferiority.
Right. They set a threshold beforehand, a non-inferiority margin of 4.4 millimeters of mercury. Essentially, they decided if amiloride's effect was within 4.4 points of spironolactone's effect, they'd consider it not worse than or non-inferior.
Okay, that setup seems pretty robust. So the big reveal, what did they actually find after the 12 weeks?
Well, the results were quite interesting. The average drop in home systolic blood pressure was about 13.6 millimeters of mercury for the amiloride group. And for the spironolactone group, it was slightly more, around 14.7 millimeters of mercury.
So spironolactone lowered it a tiny bit more.
A tiny bit, yes. The difference between the two groups was just 1.1 millimeters of mercury.
Ah, and that's well within the 4.4 margin they set.
Exactly. So, based on their definition, amiloride was indeed non-inferior to spironolactone for lowering systolic blood pressure.
That's significant. Any other key findings?
Yeah, a couple of things. Interestingly, a slightly higher percentage of people taking amiloride actually reached the target blood pressure below 130 systolic. About 66% in the amiloride group versus about 55% in the spironolactone group.
It is interesting. What about side effects? That was a big motivator here.
Right. There was one case of hyperkalemia, that's high potassium in the amiloride group, which led to that person stopping the medication. So that risk still exists, though it seemed rare here.
Okay.
But importantly, there were no reported cases of gynecomastia, that breast enlargement issue, in either group during the 12 weeks.
None at all, even in the spironolactone group.
None reported in the study duration, which is perhaps a bit surprising for spironolactone, but maybe related to the dose or the short time frame, but certainly none with amiloride.
And the study participants, any notable demographics?
The average age was 55, and about 70% were male. There weren't any significant differences in these basic characteristics between the two groups, which is good for comparison.
Okay. So pulling this together, what are the main implications if amiloride is just as good, essentially?
Well, the biggest implication is that amiloride could be a genuinely effective alternative for people with resistant hypertension who aren't getting results from the first 3 drugs.
And crucially, potentially without certain side effects.
That's the key takeaway, I think. The potential to avoid hormonal side effects like gynecomastia is a major plus. It could really improve someone's quality of life and make it easier for them to stick with the treatment long term.
So it could broaden the options for doctors.
Absolutely. It gives them another tool in the toolbox, allowing for more personalized care, matching the drug profile to the patient's needs and tolerances.
Makes sense. But as always, we need to talk about limitations, right? No
Yeah.
study's perfect.
True. We already mentioned the open label design. Even with the blinded endpoint, knowing the treatment could potentially influence things in subtle ways.
Like maybe reporting of other minor side effects or just how people felt generally.
Possibly. Also, that one case of hyperkalemia with amiloride, while just one case, is a reminder that monitoring potassium is still important with this drug, too.
Okay, what else?
The study was done entirely in South Korea. While the biology should be similar, results don't always translate perfectly across different populations worldwide. We might need studies in more diverse groups to be fully confident.
Good point.
And finally, it was only 12 weeks. That tells us about the short-term effects, but for a condition like hypertension, you really want to know about long-term effectiveness and safety, over years.
Right, 12 weeks isn't very long in the grand scheme of managing blood pressure. So given all that, what did the researchers themselves conclude?
Their conclusion was pretty clear. The team, led by researchers at Yonsei University College of Medicine, stated that amiloride showed non-inferior efficacy, basically. It worked about as well as spironolactone for reducing systolic blood pressure in these patients.
And they highlighted the side effect aspect.
Yes, they specifically suggested amiloride could be a valuable alternative for patients who can't tolerate spironolactone side effects, particularly the hormonal ones. They see it as potentially expanding the therapeutic options available.
It certainly sounds promising. So thinking about this, maybe for you listening, these findings about amiloride, especially avoiding certain side effects, might spark some questions.
Yeah, perhaps about your own health management or just how medical research works. Maybe it's something to discuss with your doctor if resistant hypertension is relevant to you.
Or it might just make you curious to look deeper into how treatments for conditions like hypertension are constantly being investigated and refined.
Definitely food for thought.
So to wrap up our deep dive today, this study suggests amiloride is pretty much on par with spironolactone for lowering blood pressure in tough-to-treat resistant hypertension cases.
And the really interesting part is that amiloride seems to achieve this without the risk of those hormonal side effects linked to spironolactone.
It offers a potential alternative that could be better tolerated by some people.
Exactly.
We hope this gives you a clearer picture of this specific research. If you're interested in digging into the nitty-gritty details, the original study was published in the Journal of the American Medical Association, often called JAMA.
Yeah, definitely worth a look if you want the full scientific picture.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.